So as we know, like CD19 CAR T-cell therapy changed the landscape of patients with relapsed refractory large B-cell lymphoma, but still like half of the patients don't experience durable remissions. So T-cells and CAR T-cells, they need cytokines to proliferate and survive. So we designed this study to combine Liso-cel or lisocabtagene maraleucel commercial CAR T-cells with NKTR-255, which is a pegylated IL-15 agonist that supports the proliferation and survival of T cells. So we're hoping that in adding NKTR-255 to commercial standard of care CAR T cell therapy, would see like increased expansion of CAR T cells and therefore increased outcomes. Yeah, so patients in this study received lymphodepletion chemotherapy followed by Liso-cel infusion per standard of care. And then they received NKTR-255 at like different dose levels, different cohorts, 3 doses every 3 weeks. So there was like cohort A, we received a lower dose, started at day 14. Then we escalated the doses at day 14, and one cohort started the NKTR-255 infusion at day 10. So our data suggested that patients who received NKTR-255 starting on day 14 or later at the dose of 1.5 to 3, so the lower doses, they had the better CAR T-cell expansion. So the data suggested that lower doses starting later after CAR T-cell infusion result in the best outcomes and the best CAR T-cell kinetics. So Liso-cel alone, it's a very efficacious product. Like I mentioned before, like most patients respond, there's a high CR rate. But again, most patients will eventually either not respond or relapse. So we found similarly high response rates in this study. But I think what is more exciting about the data is that from the patients who achieved CR, like only 1 relapse at the last follow-up. So if this data with the longer follow-up, if we do see that this duration of complete remission is maintained, so this will change the landscape or change, it will be different from Liso-cel alone. So that's the hope, but we need more follow-up to confirm that. CD8 CAR T cells or CD8 T cells are the so-called cytotoxic T cells. So they are the ones that are probably doing the heavy lifting in treating, in fighting the cancer. So with Liso-cel alone, we do see that CD8 CAR T cells are the ones that they expand more. And CD8s are the main subset of T cells that express the receptor of IL-15 or IL-15 receptor alpha. So it's not surprising that we saw this major effect on CD8 T cells, which again mediates the anti-tumor effect of CAR T cell therapy. Moving forward, we need like confirm this data in larger studies, meaning like a phase 2, ideally phase 3 studies, including like patients treated with commercial CAR T cell therapy. I think that the rationale of the agent will allow this to be tested in other like diseases, other CAR T cells as well. But I think the first step, based on our findings now that we have like an optimal biological regimen, will be confirm these findings in larger studies, phase 2 or phase 3 studies, ideally. Using, again, commercial CAR T cells in large B-cell lymphoma, which is the population that we study in this early phase 1b study.